All right, everyone. The other day, there were 27 new confirmed cases of Ebola, and of course, that doesn't count the ones that they don't know about. This was a problem in the West African epidemic several years ago. The biggest problem was not the cases you knew about, it was the cases that slipped through the cracks. That has clearly begun to happen in and around Butembo. It's taken hold. There's no containment. They're beginning to lose the battle against this Ebola epidemic. The problem is, unlike in the prior epidemic, which never really took hold in any urban areas. There was like one case it got to, I can't remember exactly which, it did get to like Timbuktu or somewhere in Burkina Faso, and they managed to lock it down, but like an Ebola patient wandered across a national border, managed not to infect anyone, thankfully. That unfortunately is not currently the case in the Congolese epidemic. It's threatening several other neighboring states. It could enter those. It could spread quite easily. For the first time, Ebola is now in a substantial metropolitan area. It's been in North Kivu for a couple of months, and it's taken hold. It's beginning to spread more quickly. The problem is that the trajectory of new cases is completely upward. There's no decline in it. There's no reason to believe that it will begin to decline, because you have a situation that's arguably worse than what you had in Liberia and Sierra Leone and Guinea several years ago. In that case, primarily the extreme rate of growth that you saw of Ebola towards the peak of the epidemic was partially the result of burial practices. Suspicion towards aid workers and burial practices. Very hands-on in those cultures. You don't really have that as much in Congo. Instead, you get something worse. You get a civil war. So people are moving around, attacking things. Ebola wards have been attacked. You never really had that problem in the West African outbreak. The aid workers did not have to be surrounded by paramilitary forces in order to do their job. There have been cases now where literally Ebola ward gets attacked, people with active live Ebola go running out into the streets to avoid getting burned alive. And then they disappear, and there's no containment at all. It's almost like there's no effort to contain it. The Congolese government can't do anything about it. There is no medical infrastructure in that part of Africa. There's basically, what's the medical infrastructure of the Congo? There are going to be a couple of state-run hospitals that'll kind of sort of be capable of dispensing an inhaler and giving you ibuprofen. Otherwise, you know where you go? There's probably one doctor in a village that's 20 miles away. That's literally what it is like in a lot of parts of the world, and a lot of people in the West don't even fucking realize it. So you've got high population density, and it's rapidly increasing with exotic disease and no native containment of those diseases. It's about the worst possible scenario, too, because what I've warned about consistently in this epidemic and the last, it's not the disease that's there now. It's the disease that comes later. The influenza, for example. Flu kills some old people. It kills some little kids. It kills an immunocompromised person with end-stage AIDS or something like that. Very, very sad, but ultimately 99.9% of the people that get it aren't going to have any substantial complications. Okay, it sucks. Everyone hates having the flu. It'd be wonderful if we had a magical pill that cured it instantly. It'd be wonderful, but it's really not that much worse than the common cold for most healthy people. Then, unfortunately, you have the Spanish flu. What is it? Trenches of World War I, I believe it was. Basically, they started putting people in these cramped field hospitals. The disease just sort of spread around over and over. It stays endemic in these filthy conditions where people are immunocompromised anyway. They're not eating right. They're exposure and stuff. You have a group of people that have limited access to medicine, dense population, and it mutates. What happens is that the disease that's there now is a known quantity. You can fight it potentially. They've got an Ebola serum that kind of sort of works a little bit for people that have it. They do have a vaccine that shows some degree of effectiveness, which is good that they developed that. But what if it mutates? The problem is the larger the number of cases is, the more chances, the more points at which one of those little teeny tiny viruses can mutate, get into another person, infect them, start replicating, and then you've got all hell breaking loose. This is, by the way, what happened with the West African epidemic. At first, it didn't follow that trajectory. It mutated. They found out it mutated several times after the epidemic was over. In testing, the samples that they had, they found it mutated. First, it mutated and became more potentially infectious. It became more easily droplet-borne. Thank goodness it didn't go fully airborne, or I probably wouldn't be talking to you right now. World order would have broken down. There was thankfully a second mutation that stopped it, trust me, from continuing as a pandemic to kill everyone in these fucking countries. There was a second mutation that vaccinated the population by giving them asymptomatic Ebola. They were very lucky. The odds of that having happened are extremely low. Look, the odds of it going fully airborne are probably about the same. It was a miracle. Fundamentally, we got the human race got a lot luckier than you think. Why do you think that for the first time they started deploying millions and millions of dollars and high-class resources to try to develop vaccines and serums and stuff? They freaked out because they said, oh shit, we never expected Ebola was particularly prone to mutating. The thing is, it was always taking place. Ebola was an exotic disease that killed a small village. Never had enough chance to mutate. It would burn through the village, everyone either died or didn't die, never really got a chance to mutate. And if it did, it didn't really matter because there could be a week before anyone from that village even sees an outsider. So there was really no travel. But it's in Butembo. There's a lot of travel in Butembo. There's also travel to several major metropolitan areas even larger that have international airports. That could be a little bit of a problem. What happens if there's an Ebola case that crops up randomly in Tripoli? What happens if it makes it to a place like Cairo with millions and millions of people and semi-modern transportation system? What happens if it ends up in Istanbul or it gets to Jerusalem? What happens if it hits Dubai? My goodness. Won't be people making jokes about it. I understand sort of the macabre, the grave humor and stuff. I'm into dark humor, and Ebola Chan's like funny and stuff. But it is something to be legitimately concerned about. This involves, real human beings dying and suffering, number one. Number two, this is an apocalypse waiting to explode in our faces, and most people don't even know it's happening. The fact that there were 27 new cases in a day, that's a considerable increase over past trajectories. It could already have mutated. It could be mutating as we speak. And some little boy in a Congolese village somewhere could be carrying super Ebola that's fully 10 times more infectious. He gives it to his family, they give it to the village, and a week later all of a sudden 1,000 people die. And it starts spreading like wildfire. It could be the next fucking Black Plague. Nobody even cares. Nobody even appears to know that the epidemic is occurring. I think human ignorance is going to be our downfall yet again. Unfortunately, with the density of the world rapidly inclining in most parts of the world, with billions and billions of more people expected in the world in the next fucking decade alone, you've got more chances for mutation to happen. It is only a matter of time before some disease, maybe not even Ebola, could be the flu again. It could be that the plague enters a population in China, mutates and kills everyone. It could be like the stand. Yes, it could. We are more likely, the human race is more likely to get knocked back an epoch or two by a pandemic than we are to have a nuclear war in the next 50 years. Scientists say nuclear war is still #1 concern, asteroids and... No. Pandemic. Absolutely. Nature is going to wipe us out more thoroughly than we can. A nuclear war would kill fewer people. Hell, we could almost cut the head off the snake, reduce the world's density by a good order of magnitude with a nuclear war. We'd probably be better off for the next century, ironically enough, even if we did fucking cause a nuclear winter. Yeah, Ebola could get out of hand real quick. The WHO says it's not yet a global health emergency. Yeah, we know that this virus mutates readily, and we know that it's in several decently sized metro areas, 0% containment, and you get a civil war and mounting stress over the political system there that could blow up into street riots involving fucking Ebola patients of all things. Not a particular emergency. Wash our hands of it. What are you going to do if it starts spreading more rapidly and you know that it mutated? Are you going to quarantine the entire region with a civil war going on? Whose military is going to be willing to do that? Congolese military? They can't even suppress the guerrilla fighters that are already there. Is Rwanda going to mobilize its troops? Are Kenyans and Nigerians going to enter the jungle and try to kill off of these civil warriors before they kill the world? Yeah, I don't. Is the U.S. military going to get involved? Are we going to have to invade Congo in order to take care of the fucking situation? Will there be Russians showing up? Because I guarantee somebody is going to show up if it starts going full pandemic mode. I guarantee something's going to happen. They were on edge enough about the last epidemic. Basically, the function of government in those 3 nations that were afflicted shut down. They still haven't economically recovered, especially Liberia. It's basically a non-functioning state because of an Ebola epidemic. It killed a bunch of people, including a lot of medical professionals, which, stamped out what little was there as far as their medical infrastructure went, number one. It rocked their population, it demoralized people, it left lasting psychological effects on the whole population. Reduced GDP substantially. It knocked them back to like 10, 20 years in growth. You gotta understand that this could be a dire situation very, very easily. It's not the epidemic that's there, though. It's the epidemic that's coming that should worry you. That's about all. Peace out.